Welcome to all of you out there. Welcome to the program agenda. I'm your host, Cito Beltran. And today, May 12, 2021, it's a Wednesday. We welcome you to be part of today's agenda, which is all going to focus on two particular things. Number one would be the Indian variant, the COVID-19 Indian variant, and the effects or the impact of the variant regarding health protocols, regarding the possibilities, etc., etc. And after that, we will focus on the state of our trade and industry and ask Secretary Mon Lopez what else is there aside from consumer-based or consumer-dependent businesses, etc. Because may mga nagsasabi po, masyado ang focus natin sa mga restaurant, sa mga dine-in, etc. Pero close open naman ang close open. So we will have a somewhat serious discussion with the Secretary, all of that here on agenda. But first, let's go to the front page of the Philippine Star. The COVID variant first detected in India is now in the Philippines. The Department of Health announced that yesterday. 2 cases of the B1617 variant has been detected. Both patients were isolated when they arrived in the country. One is already declared recovered, while the other has already tested negative. Let's discuss more about the variant with Health Undersecretary Maria Rosario Vergeire in a few minutes. Meanwhile, Malacanang says the Interagency Task Force is scheduled to meet on Friday to discuss the new quarantine classifications for NCR+. Malacanang also says the new protocols are most likely to be announced on Friday as well. In other news, the Anti-Red Tape Authority, or ARTA, has issued a show cause order to the Food and Drug Administration. The issue, the FDA's alleged inaction on over 600 applications of pharmaceutical companies. ARTA is ordering the FDA to explain its side on the matter. Excuse me. Okay, and those are the choice news items presented by Team Agenda from the front page of the Philippine Star. Now, let's go to our first guest, Undersecretary Maria Rosario Vergeire, because I understand the good Undersecretary is pressed for time. Alam nyo, talagang isa siya sa pinaka-busy individual sa Republika ng Pilipinas ngayon. Usec, good morning po.
Good morning po, sir. Magandang umaga po sa inyo.
Looking good, and I love that you're allowing your gray hair to show. Yung wife ko talaga, basta nakakita ng babaeng may gray hair, pinupuri niya kasi hindi uso sa amin yung nagtitina all the time.
Thank you.
Anyway, Usec, I know that you have a very little time available, so I'll go straight to the point. Now, 2 individuals have been found positive for the Indian variant. From what I picked up, there are 3 kinds of the Indian variant. Now, this tells us, according to Dr. Ong, your colleague, na the system is working. Nasasala natin, nahahanap natin sila, at naitatabi natin sila. The question is, dalawa lang ba? Is there possibly more? Because we were watching people coming from India, but then we found these 2 guys from Oman and from, I think, was it Saudi Arabia?
It's from the United Arab Emirates.
Oh, okay, UAE. So, is the system able to catch others, or is it a big enough a net to prevent this variant from coming in?
Well, actually, our biosurveillance is not intended to catch everybody because of the limited resources that we have. The objective really of this biosurveillance that we are doing is first, of course, to know if there are any of these variants present here in the country. And we have already proven that. We have the UK variant, the South African variant, we have the Brazil variant, and now we have the Indian variant. The second objective of this biosurveillance is for us to know the reasons why there are clustering of cases in specific areas. We do purposive sampling for this biosurveillance. So for that question, if it is possible, if there are still other individuals in the country with the Indian variant, well, that might be possible because our biosurveillance, as I've said, cannot test everybody.
Okay, so mag-ingat po tayong lahat mga kaibigan, bagamat nakabantay ang mga Gwardiya Sibil ng DOH, meron pa rin makakalusot dyan sa dami nitong mga virus na ito. Ngayon, Yusek, the next question is the Indian variant really, truly exceptional? Or was it simply, a case of, kasi marami, inumpisa ng kampanya ng mga politiko all over India. And then nagkaroon sila ng religious festival where millions of them, literally millions, went to the Ganges River and nagbabad silang lahat doon, much like yung doon sa gubat sa syudad, and nagkahawahan. So, is it a really bad virus or bad combination of circumstance?
I guess I would go for the second, no? So that the Indian variant was the tip of the iceberg because we are seeing multitude of factors that has affected the increase in the number of cases in India. This would be mobility, these mass gatherings, and of course the lack of compliance to the minimum health protocols. And we have observed that in the numerous activities or events that has happened in India. But one thing I can say, the World Health Organization already has declared this as a variant of concern of global at that global level. No, so it means that it is really significant and it's really something that we need to monitor carefully because we are seeing the effects in the country of India.
Okay, now I've also picked up some allegations. I won't call them scientific data or reports, official report, but some allegations that the Indian variant has three forms, and one of those three forms eludes traditional or conventional testing processes like RT-PCR or antigen. Kumbaga, nalulusutan daw yung existing testing natin. Is this true or sabi-sabi lang na naman ito?
Well, there are three types of mutations. Actually, there are 15 mutations in this Indian variant. These mutations, these 15, three of which we are watching closely because the three mutations would give you the effects that South African and the UK variant has, meaning it has increased in transmissibility. It can neutralize antibodies. It means that it can affect natural immunity, like when you get infection, you get your antibodies. It might affect your antibodies, or if you were vaccinated, it can also affect your antibodies. And then the third that they are saying, this T478K. But as to the testing, that they cannot be detected by the regular RT-PCR, we do not have sufficient evidence for this, and it has not been given as an information also by WHO.
Okay, now allow me to just touch on what you mentioned regarding immunity. Kasi nung nabasa ko nga yung report, I thought that it will defeat the vaccine. Pero you are saying that by at large it can affect your natural immunity period regardless of whether you have been vaccinated or not. Pag tinamaan ka, bagsak yung resistensya mo or your immunity.
Well, it doesn't really say that your immune system would totally go zero. It just means to say that it can affect the antibodies in your body. As what we
Okay.
had been discussing, even with the other variants, as for example, the South African variant, it has been said that it will affect your neutralizing antibodies for the South African variant. And it was studied no, among these vaccines that we have right now. So the recommendation of WHO and other credible institutions would be to continue on vaccinating because it doesn't affect it and remove it totally. from your body, it is still there. It can still protect you, but it is affected by the variant. So we just continue on vaccinating, and these antibodies that we get from natural infection, let's boost it with these immunizations that we're having right now.
Okay, I myself have had my first shot with Sinovac, which proves I'm not choosy. Okay, but nagpabakuna na po ako, and I am promoting to everyone, get vaccinated because at least in one way or another, we have some defense. Now, the question is Sinovac, because it is the dominant vaccine on the ground and among Filipinos, is Sinovac potent enough to somehow neutralize the Indian virus? Kung tamaan ako ng Indian virus, of course, I'm not going to be bulletproof. We all know that with vaccines. But will Sinovac at least ensure I don't croak tomorrow?
Well, there is still no complete evidence, no, as to this study among these Indian variants. But what I can say would be there had been studies among the other vaccines that we have right now, including Sinovac. There is a study in Chile, which says that for the other variants, it can also be effective. Actually, when we talk about the effect of these variants among these different vaccines and the individuals, they say that it affects the efficacy of these vaccines among individuals for those mild to moderate individuals. But for severe infections, it still has that full protection.
Okay, so at least we will have some protection against the vaccine. Now, some people are wondering if we were to compare, if we were to put UK, South Africa, and the Brazil, the P1 and the Indian variant, are they all in the same category, or mas malakas talaga itong Indian variant, or is it kasalanan namin mga media?
We need further studies for that. I think that Indian variant is a cause of concern because we are seeing the effects in India. But we have to go back also as to the effect of this UK variant in UK the
Yeah.
first time it was detected. So we need to be cautious in our interpretation that the Indian variant is deadly, that the Indian variant will cause more harm, because all of these variants really would cause more harm. It will cause more transmissibility. It will affect your antibody production or your neutralizing antibodies in your body. So the bottom line and the message for that would be that among all of these variants, no matter what variant there is, we still have to be very cautious. If only we can follow minimum health protocols, follow border controls, and then we can be able to prevent this from having more transmission in the country.
Okay, now may I jump over to the vaccination program, because you and I and many others would like to promote the vaccination program. How confident are we? And syempre, nagtatanong na rin ako kasi na 1-0 na ako. How confident are we that we will get our second shot? Kasi biglang may Moderna na, biglang meron ng Pfizer, may AstraZeneca na, biglang iiba sa amin, nagsasabi, teka, siguraduhin natin may Sinovac, baka biglang lilipat na naman tayo ng ibang brand.
Let me tell you, no, and I would like to assure the public that you will get your second doses. The government has this kind of strategy where when we give our first doses, we reserve our second doses for the individuals that we have given the first dose already. It's different for AstraZeneca because we were able to give this as first doses for the initial run, no? For the initial delivery, we gave it to all uh, 525,000. Now we have the second doses for the 525,000, and we have extra of 1.5 million that will also be given as first doses. And the second dose for these AstraZeneca vaccines will come in by the first or second week of June as committed by the WHO. So it doesn't have to be something of a worry for our citizens when it comes to their second doses, because the second doses are preserved and reserved for them so that they can complete their vaccination.
Okay, now there is a concern, Yusek, among people in the provinces. Paano naman daw sila? When are they going to get their vaccines? And alam mo kasi I'm here in the province right now in Batangas, and I regularly hear that some people text me, Kuyang, paki-follow up naman. And also, by the way, also foreign residents, those people stuck here, people who are permanent resident, what is the policy or the plan of the Department of Health and the IATF regarding both parties concerned?
Yes, when it comes to foreigners, we're not going to differentiate if you are a foreigner or a Filipino. As long as you are here in the Philippines, you will get vaccinated because you can contribute to the herd immunity that we would want. And we do not want that you are not vaccinated and everybody around you will be vaccinated. So all foreigners, if you are here in the country, especially if you are residing here in the country, you will be receiving your vaccines as well according to the prioritization framework. As to the other regions, we are slowly adding some more doses for the other regions. If you will happen to know, we have this strategy of herd containment for this epicenter that we have right now, and that is NCR plus bubble. We
Mhm.
have given much of the allocations to NCR plus the other provinces around NCR so that we can contribute to the containment of the disease here in this area. But we have now, with this newly delivered vaccines, we have given more allocations to the other regions already.
Okay, I know I'm down to my last 4 minutes with you, and I will utilize it wisely. What about regional areas na nagkakaroon tayo? We are experiencing spikes, outbreaks, like in Negros, I think Cagayan de Oro or something. What's going on there, and what is the DOH doing about it, USEC?
Yes, that is something that we have already discussed, and we had been monitoring these areas for the past weeks already. And actually, in the IATF, we have recommended for the escalation of some of these areas. No, so we will be having the decision this Friday when we discuss with the IATF. We are seeing right now that although in the national capital region and in the nearby provinces, cases are slowly declining, we are seeing an increase in the number of cases in certain areas like Region 4B, like in Region 9, in Region 6, in CAR region, in Region 2. And we are now trying to coordinate well with the different local governments through our regional offices so that we can prevent the uptick of cases in these areas. We also are seeing a higher utilization for their hospital beds in this area. So we are now trying to monitor, and we have recommended already the escalation of some of these areas and will be discussed in the IATF on Friday.
Okay, it was reported recently that AstraZeneca vaccines, I hope I got it right, the recent batches will expire June 30 or July, end of July. Will this mean that you will speed up the vaccination or the schedules? Because someone is asking, yung bang mga A4, will the A4 be front loaded because you have to speed up the consumption of those batches?
There are still a lot of individuals not vaccinated in our A2 and our A3 population. So we are still going to vaccinate the A2 and the A3 individuals. Yes, we are going to speed and scale up. So for this 1.5 million, we are going to give this as first doses. We are not going to reserve the second dose for this 1.5 million to be provided to A2 and A3 individuals across the country. Now, for this 530,000 that was left will be reserved for the second dose of those individuals initially given with AstraZeneca last, I think, March or end of March. So all of these 2 million doses, no? So to expire by June and July will be given immediately, and we do not need to worry because it's not going to be wasted. We still have to follow the prioritization framework of A2 and A3.
Okay, what about those on in the A2, A3 category na who are being choosy? Kumbaga nagtatago muna sa mga iba-ibang lugar to be safe and waiting for the Pfizer or the whatever the better vaccine. Will they be penalized like okay, you're late or you didn't show up, you were absent twice, you go back to the back of the line. Magkakaroon ba ng ganung policy?
Well, sir, with our operations right now and it's being scaled up, one thing I can tell these people that you get your vaccines no matter what vaccine there is in your area. Because of the uncertainty of global supplies, I suggest that if you are a vulnerable person, get the vaccines already. Now, for these people who have been choosy, if the local governments know of this reason, they have to be at the bottom of the line. Now, some people might be able to escape, no, or be able to go through the process without being penalized. So we just want to inform everybody that we have this moral obligation, and we have to follow the prioritization framework. And we are saying right now, whatever vaccine is available, please take it because it will protect you and your family.
Okay, thank you very much, Yusek Vergeire. I really appreciate that you are very forthcoming with that kasi talaga merong mga unfortunately are being choosy, mentally choosy. Eh kami hindi na kami choosy. Thank you very much. It's already 8:20. I have to release you. Thank you very much, Yusek Vergeire. God bless you. God protect you and your loved ones in this time of COVID. Have a good day, ma'am.
Maraming salamat po.
Okay, that's Undersecretary Rosario Vergeire. And ayun po, no, reminder lang doon sa mga kaibigan natin, mga kababayan natin, our countrymen, okay, who think they have the option na, oh, I will wait muna. I will wait until I'm sure it's safe, that the vaccine is safe. Or who think, I will wait when they have Pfizer na or when they have Moderna, etc. Kami po, ako po, yung wife ko, my wife Karen, who is from Holland, we already got vaccinated in Pasig, first dose pa lang. And we got Sinovac. Because at the end of the day, regardless of the brand, wala namang ano yan eh, walang pinagpipilian ng COVID-19. If you have no protection, you're going to get hit. And I remember sharing with you people, with you, our viewers, I have a nephew, kumbaga anak ng barkada ko, very close friend, nasa Amerika. Nurse siya, male nurse siya. Sila yung una, they were the first batch to be offered vaccination. And he said, I'll wait until all my friends get vaccinated and I will see how they react to the vaccines. Tinamaan po ng COVID-19. And okay, thank you, Yusek Vergeire, for clarifying all our expat viewers, foreigners living in the Philippines, foreigners stuck in the Philippines, foreigners married to Filipinos, also stuck with Filipinos. Okay, you can get vaccinated. You must be vaccinated. You should be vaccinated, and you will be vaccinated as per Undersecretary Maria Rosario Vergeire. We will go for a quick break. When we return, tuloy-tuloy po ang agenda. Welcome back to the program Agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV channels 8 and channel 250 for high definition. And also on Facebook, you can watch us via facebook.com/onenewsph. And on YouTube, just enter One News PH. Of course, if you download the Signal Play app, you can watch Agenda, on the go. And what else did I miss? Oh, by the way, thank you very much, PLDT. Araw-araw po ako magpapasalamat sa PLDT sa home fiber internet nila because as you notice naman, wala tayo ngayon sa Kapitolyo, sa Pasig. Nandito tayo sa Barangay Inusluban ng Lipa where we are broadcasting. In the meantime, we will soon be interviewing Secretary Mon Lopez. Alam niyo po, gusto ko kasing makausap si Sec Mon dahil in a recent interview, I think about a week ago, we spoke with ano na ba ito? Papatayin ako ni Doc Jim. Dr. Jaime, yung bang sa Private Hospitals Association. Tawag ni Re, Gabriel, rescue naman dyan. Okay, Jimmy Almora, yun. Ako nang, yung pala, Almora. Okay, Jimmy Almora. Doc Jimmy shared that practically everything they use in a hospital is imported. Akala ko yung bulak dito galing sa Pilipinas. I seriously thought that our the cotton material for the OR, the gauzes, the gloves, etc., are already produced in the Philippines. As it turns out, according to Dr. Jimmy Almora, all of it is imported. Pwera pa yung machines, yung high flow cannula, yung respirator, yung ventilator, etc. Lahat yun are all imported. And that is weird. In a country teeming with brilliant minds, with intelligent Filipinos, you kind of wonder, why do we have to buy all of this from all over the world, particularly China? I remember at one point where we were promoting Buy Philippines, and several people actually came out and responded or reacted by saying or telling me na, Cito, yung relo mo, bagamat ang brand, Amerikano, made in China yan. Yung laptop mo, made in China yan. Yung microphone mo, made in China. Yung noodles, made in China, etc., etc. So there were very little that was made in the Philippines. And you have to ask why. And people will say, well, kasi ganun talaga ang business eh. Kung hindi papasukin ng tao, walang negosyo. But perhaps it's about time that government change the playbook. Maybe government should now initiate a Make in the Filipino program. Let's hear from Secretary Mon Lopez. Sec Mon, good morning, sir.
Good morning, Cito. Good morning sa lahat.
Pasensya.
Naayos ko na naman yung aking computer.
Pasensya na, Sec. Alam ko, every morning ginagambala kita dyan sa iyong opisina at napansin ko, mukhang meron kang oblation award dyan sa likod mo. Alam ko, pinagmamalaki mo yung pagkayupi mo. Anyway, Secmon, I hope you heard my intro, and it is essentially, I interviewed the president of the Private Hospitals Association, Dr. Jim Almora. And he was explaining to me bakit ang mahal-mahal ng hospital. Sabi niya, Sito, lahat ng gamit sa hospital imported. Pati bulak imported. So I said, what? And then, of course, as we were promoting, as you may recall, we were promoting Buy Filipino Made. And then some Filipinos told me, halos wala namang Filipino made na consumer goods, karamihan made in China. So that, and then, pati nga itong recent dilemma, yung nangyari sa India. If you notice, they are now asking for oxygen tanks and oxygen to be brought to their country. Parang sabi ko, I don't want that to happen in the Philippines. We should start talking about this issue. Sec, your thoughts, please.
Okay, unang sa manufacturing and then sa oxygen. Medyo mahabang storya yan sa manufacturing because it's a product of decades of economic policies, no, that we've done for many dekada na. Simula nung mga 80s nung nag-umpisa yung globalization, the concept of globalization and opening up of market. Prior to that, the tariff rates were so high, 50% to 100% para ka maka-import. So, at may mga import restrictions. So, yung ibig sabihin, kukuha ka pa ng import permit bago ka maka-import. So, dyan nag-umpisa yan. And in other words, different countries were protecting their different industries by imposing high tariff. And Philippines had shall we say, an active manufacturing sector. Marami minamanufacture dito. But in the process of yung liberalization over the years, nag-tariff reform program noong 80s, bata pa tayo noon, at kasama ako noon sa mga tariff reform, yung mag-reduce ng mga tariff ng maraming produkto. And all our countries were doing that, part of WTO and GATT pa ang tawag noon, General Agreements on Tariffs and Trade, at nagkaroon ng mga free trade agreements na regional, malawakan, pababa na ng pababa yung mga tariffs. And the basic principle is, as you mentioned, yung mga mas magaling mag-produce na country, siya ang magpo-produce noon at i-export doon sa mga country na mas mataas ang cost ang production. At ang Pilipinas, may mga magagaling ding i-produce, yun ang ine-export natin. Kung sino yung mas magaling, yung tinatawag na may comparative advantage, yun ang naging kalakaran na. No? So kung sinong globally competitive to produce a product, siya ang nag-export. Because nire-reduce mo yung mga protection. Wala ka nang tinataguan ng mga protection. So, dyan nagsimula yan, and over the years, lumalabas ngayon, sino yung natitirang matibay na competitive sa particular industry. So, maraming nawalang industriya dito, even textile nawala, and iba pa na dating manufacture dito, eventually ini-import na lang. To the point of some people na nag-comment, actually pag ini-import, supposedly mas nakakamura. Kasi kaya mo in-import, mas makakamura ka eh. So, pag sinabing in-import yan, dapat mas mura yon. Otherwise, dito ka bibili sa locally manufactured products. So, dito lang nagkaiba. Over the years again, habang nagbababa ng taripa ang maraming Hello?
Yeah.
Ayan. Habang bumababa yung tariff rates, yung ibang country, sinusupport yung manufacturing. Okay, bumaba yung tariff, pero bibigyan na ng tinatawag na subsidy or support dun sa mga manufacturing. Whatever way, no? Free rent ng kanilang lugar or support sa kanilang operating cost, sa power, and lahat. Maraming support. Sa Pilipinas, talagang matibay. Again, kasi kung sino yung magaling mag-produce, siya ang mag-produce. Maiiwan, matitira. So, kaya eventually, yung ibang country were able to continuously develop yung manufacturing nila. Dito sa atin, talagang exposed ang mga manufacturers na matibay na. So, dahil po doon, eventually, may mga nagsara na industriya over the years. At totoo yan, kaya marami na tayong ini-import, no? At marami tayong ini-import at nakaka-export din tayo. Pero ang naging resulta, fast forward to now, mas malaki yung ini-import kaysa ina-export.
Yeah.
Okay, so hindi naman masasabing wala tayong ina-export. Yung sabihin, nakaka-export pa tayo nung mas mura dito gawin because matetest mo walang tariff, walang import protection na. So yun yung mga pinuproduce natin. Ang mga naiwan na sensitive products na parating merong tariff rate protection, yung mga agriculture products. Kaya mapansin mo, matagal hanggang ngayon pinag-usapan yung even 2 years ago or last year, 2 years ago na pala, yung rice tariffication law, rice, sugar, yan, chicken, pork, lahat yan may mga tariff rates pa. In fact, meron pang import licensing requirement. In other words, yung permit na requirement. So mga protected sectors pa yan. Kasi nga, pinoprotect yung mga local producers. So basically, these are the products that are still being produced now. We're heavy exporters. Of course, biggest export natin ngayon, electronics. And electronics, we can say, is very competitive kasi over 60% of our exports electronics, and we are able to compete with other countries. We are producing certain stage of production. Just like in other countries, that i-importahin nila, i-re-export. And ganito
Yeah.
din yung nangyari sa Philippines.
Sekmon, yeah, thank you for the explanation, because at least maintindihan ng nanonood and even myself, because I tend to forget these things. But the question is, am I right or am I wrong to say na dahil sumunod tayo dyan sa WTO, GATT, etc., we have actually, kumbaga parang doon sa West Philippine Sea ba, tayo sumunod tayo doon sa usapan, pero yung China hindi. And right now, what's happening is in the trade and industry, we have been very cooperative with all of these world agreements, these trade agreements, to our disadvantage. And isn't it possible for us to simply reignite those industries that are essential for local consumption? Kasi parang yung going back to the hospital example,
Yeah.
parang essential to eh. Bakit kailangan kong i-import to? Dapat I have food security, I should have health security, etc. Secretary.
Exactly, tama po yon. Since dito sa mga agreement na to, walang balikan nito, hindi mo pwedeng itaas uli yung mga tariff. But that's part of the agreement. Okay, so to the first question, tayo ba yung mabait sumunod? Yes, tayo yung good boy. Sabi ko nga, sumunod tayo, tapos pinabayaan natin yung mga manufacturers, just be competitive, no? Do your best. Sa iba, sinuport, binigyan subsidy. Pero tapos na yan. Ngayon, may usapan na dyan na wala dapat mga subsidy and support. So masasabi mo medyo mas patas na ngayon, pero tapos na yung nasuportahan na nila yung mga industries nila, and they all grew already. That's why pwede na nilang hindi masyadong tulungan. No? So, nandiyan na yan. So, what can we do now? So, that's the reason why recently we've been pushing for buy Filipino, buy local, go local. For example, kung ang government ay using taxpayers' money ay may bibilin, lalo na dito sa mga health emergency products na ngayon, equipment, devices, sana ito buy local na. Using taxpayers' money, local money, local products. That's the basic principle we're pushing for. Lalo na pag ito yung mga government projects, we encourage manufacturers to produce locally. So dapat sana ito rin pina-encourage ng government mag-produce, dapat binili rin yon ng government. So ito yung principle that we want to happen dito sa yung nakaraan, yung PPE and overalls. Okay? It's just that right now kasi may batas nga ng bidding na kailangang i-bid pag may government procurement. So what we need is a new law that will say government procurement, especially for government projects, pwedeng diretso bibili na para buy local rather than ibibid mo, mananalo yung galing sa ibang country na again mas mababa yung cost. So
don't you have a champion? Don't you have a champion to push for that law? Kasi parang that would be such a popular law. One would imagine that there would be 200 congressmen jumping on that bandwagon.
Yes, tama. So ngayon meron ng pinag-uusapan na like Pandemic Act, no? That will basically cover this na pag may local production, kasi government procurement hindi tayo signatory sa WTO. Ibig sabihin government can say na kung gusto niya bumili local, pwedeng local ang bilhin. No? So hindi tayo pinagpapawalan about that. No?
Okay.
So example yan na yan. Example din yung potential, yung vaccine manufacturing na sinasabi natin. Na para ma-encourage natin yung manufacturer dito magtayo kasi may assurance na partner kayo ng government. Kayo mag-produce, ipapantay nyo yung costing nyo abroad para meron ka rin gauge na hindi ka tinataasan ng presyo. Papantay yung presyo and then may commitment na sa'yo bibili yung government. So yun yung isa rin sanang magkaroon ng arrangement again through a law, no? Na
Yeah,
meron
but
ganung
yeah, but Secretary, is it possible? Kasi COVID-19 has done one thing. It has basically changed the playbook. Kumbaga, all the rules of the past are simply getting in the way in the present. Like yung example mo na manufacturing, partnering with government, that's a great idea. But the manufacturers will tell you, Secretary, nakakatakot, we're scared to get into the business. And then, hindi pa kami nakakaumpisa, tampak na ng requirements, ang laki ng capital outlay, and there are no assurances, there are no contracts. Is it possible to go a step further for government to be the real partner in building the business? Kasi dito parang, sige, gawa kayo ng business, kami regulator. Instead of the regulator role, can the government be a partner? Parang yung PPP in building industries, not just, infrastructure projects.
Oh, dito naman kasi it can be a private sector investment. Ang kailangan lang yung assurance ng procurement. That will suffice. And may principle din tayo na government is not in the business of running a business. We
Yeah.
really let that iba private sector prime mover of the economy, ganun ng principle. So if private sector can do it and they have the expertise, they are from that industry, we let them do it. So ang kailangan lang nila yung market. So once we can assure to a certain degree even a market or an agreed price point na dati parang yung ngayon yung bumibili ng vaccine naka EUA and this is what is being entered into right now. Government can enter into a purchase agreement right now kasi EUA yung pinag-uusapan na vaccine. Tulad ng ginagawa ngayon pagbili ng vaccine abroad, hindi yan nag-bidding. EUA kasi yung mga brands na yon and may negotiation na from government to government or government to the supplier, manufacturer. Ayun, allowed yon. So in this particular case, if we're talking of vaccine now that are under EUA, may ganun tayong pinapasok na arrangement ngayon. Part of the green lane na pinag-uusapan kanina and yung bili ng ating presidente na bigyan ng green lane itong sistema ng pagpasok para maka-invite tayo ng mga vaccine manufacturers. And that's being done now. So meron na kaming pinag-usapan at ilalabas itong green lane system na to. Una, mabilis ang procedure. Even FDA is part of this. Will make it quick and easy na processing. At pagkatapos ay we can have some commitment in terms of purchasing kasi specific number of vaccine ang kailangan natin under the EUA. So ma-allow pa yan hanggang naka-EUA. Ang problema, pag nag-commercial na yan, let's say may CPR na FDA, commercial transaction na yan, eventually, no, at after 1 or 2 years, then siyempre open na yan to bidding. Unless may batas na tayo ng pandemic na pag available locally, you source locally. So yun yung magandang makuha sa batas. And may mga senators tayo na and congressmen pushing for this pandemic.
Okay, do you have any idea or their actual number of companies who have signed up for that green lane process for the manufacture of vaccines in the Philippines?
Yes, they are part, in fact, of the discussion. How can we make the process fast, simple, but still will assure quality? No, so dadaan pa rin yun sa inspection and all that. But what can take months and years? Pinag-uusapan dito less than a month. No, less than a month processing. And so we will issue that soon dahil nag-usap-usap na kami with ARTA, DTI, and DOH, FDA, and DOJ, and the other agencies, no? Na DOST, kasama rin natin. So yan, isa yan. And then you mentioned earlier about, like, for example, oxygen. Isa din
Yeah.
yan na
Kasi
ah,
iilan lang ang kumpanya dito sa Pilipinas na nagmamanufacture ng oxygen, and
mm,
believe it or not, I found out recently that it is harder and harder to procure oxygen kasi dati kami pupunta lang kami sa kanto o tatawag lang kami, may magdi-deliver dahil meron kami inalagaang bata dito sa barangay. But now I was told, sir, pahirapan ngayon, talagang unahan.
oo. So, ang sistema kasi diyan, meron tayong 4 big manufacturers at may isa pang itatayo. They're nationwide, may Luzon, Visayas, Mindanao. Ang capacity natin diyan, we have enough capacity. In other words, may surplus pa nga tayo. Uh, Nag-research na yung ating DTI, DOI team diyan, kinausap lahat ng producers. Wala kasing association nito, so kinausap lahat ng producers na isa-isa. And we were able to come up with the total capacity of about 604 tons per day. Just to give you a perspective, ang nagagamit lang ay 470 tons per day. So may surplus pa. Dito sa 470, nakaka-inventory pa sila ng mga 6 days to 14 days. So, ibig sabihin, we have enough or abundant supply. Ngayon, ang tanong, sabi natin, what if we have to prepare for an emergency, mag-surge,
Okay.
no?
Can we hold that thought, Secretary, for a 1 minute break? And when we return, I want to talk about that oxygen security, health supply security, etc. We'll go for a quick break. We'll be right back, Mr. Secretary. Okay, we're back here on agenda, and let's bring back Secretary Mon Lopez of the Department of Trade and Industry. Mr. Secretary, we're down to 3 minutes. I'm sorry, time flies so by. But the question is, okay, right now we have an abundance of oxygen, but as India has taught the world, it can all disappear in a week. And what are we going to do in terms of security measures regarding health supplies?
So, dito po, what our assumption is what kung magkaroon niya ng surge. So, right now, given the surplus of supply of oxygen, it can still manage even a 50% increase in current consumption levels. Pero pag nagdoble na, ibig sabihin, kukulangin na. So that's the reason why kahit may 50% increase allowance ka, surplus, we can already encourage private companies to start expanding. Kasi puro private ito, itong 4 na malalaki and one more coming up, no? For them to increase their capacity. Number 2, para lang mag-prepare tayo dun sa mag-double, assuming mag-double ang requirements. Kaya pa ito up to 50% increase. Number 2, meron ding oxygen concentrator as another source of oxygen at apparatus na binibigay sa mga pasyente kung wala yung mga oxygen tank, no? So Yung concentrator, these are all imported. So this is where, again, government or again, private hospitals can start importing already kasi walang local manufacturer. But then again, we were discussing ni Secretary de la Peña, DOST, na this is one, parang ventilator, this is one equipment that can also be developed by DOST and then may mag-commercialize ang production na private sector. So, pina-project na ngayon ng DOST ito. So, oxygen concentrator supply is also important. Puro private sector ang mga nag-aano dito, mga bumibili dito. But if you want to be prepared, we would also suggest na sana may si government, DOH of course, will start buying, reserving supply for the oxygen concentrator para kung magkaubusan ng oxygen. Yung oxygen madali produce. Ang problema dyan, Cito, yung tank. Yung tank, wala rin local production, makakapal na steel ito. More than twice the thickness of a steel ng LPG. So, talaga to, importante dito, we have also the supply of tanks. No, dun sa regular medical oxygen. Again, the other one is an oxygen concentrator, another alternative. Hindi mo kailangan ng tanke dyan. Kailangan mo lang yung mismong equipment. So, we should have a reserve supply of all this.
Well, in the end, Mr. Secretary, siguro I will have to do a part 2 with you when your schedule permits kasi ang mga iba pang katanungan namin besides the dine-in, the consumer-based industries, ano pa yung ibang industry na pwedeng ma-open up. Kasi may mga, sinabi kasi ni Cabsec Carlo Nograles na whether magbago ang MECQ to GCQ, gusto nilang ma-open up yung iba pang industries. Ano pa bang industries na nakasara? Meron pa bang nakasara?
Yes. Meron pa. Yung mga iba pang mga indoor activities, even indoor sports, ibang mga tourism, mga museum, expo, type of facilities, mga naka-close pa yan. But I would say, and of course in personal care services, apat lang yung binuksan under that, di ba? The barbershop, the parlor, salons, and nail spa. Pero marami pang ibang personal services. Nandiyan pa rin yung mga dating bukas na a bit of entertainment, no? Live events.
Yeah.
So yan pa yung mga pag-aaralan pa kung bubuksan.
Okay.
Kaya ang pinag-iisipan lang ngayon, Cito, yung MECQ tayo na may opening which is okay din kasi we're opening up. Mas importante bukasyon sa trabaho kahit MECQ. So MECQ with opening or GCQ na may restriction pa rin sa movement.
Ayun, kasi
iingatan natin yung indoor. So, dati, pag GCQ, ang restaurant natin up to about 50%. But because of this indoor issue na aerosol, posibleng umiikot ang virus, hindi lamang sa katabi mo, nag-iingat tayo ngayon sa pagbubukas ng mga indoor facilities na matao.
Okay. Pasensya ka na, Sec, kasi alam mo, pag sinabi sa aking industries, iniisip ko, manufacturing talaga, yung kumbaga, may mga makinarya.
Manufacturing kasi, open na tayo sa manufacturing. Okay. So, okay yung mga naiwan itong mga services, pero may mga labor intensity kasi dyan. So, trabaho na ang hinahabol natin dyan. Meron pa nakakabalik na trabaho kasi.
Thank you very much, Ramon Lopez. And pag may oras pa kayo next time, please let me know kasi maganda yung naintindihan ng mamamayan natin ano ba talaga nangyayari and bakit nangyayari. Thank you very much, Ramon. God bless you.
God bless. Salamat po. Stay safe.
Okay, yan po si DTI Secretary Ramon Lopez, and at this point of the program, meron tayong pahabol na interview kasi medyo pahirapan maghabulan ngayon dahil may mainit na topic. Yung pong deklarasyon ng state of calamity for African swine fever sa Pilipinas. Yun po, nagbulaga na siya. Si Sir Rosendo So. Good morning, Mr. So, and welcome to the program.
Yeah, magandang umaga, Manong Cito, at magandang umaga sa lahat.
Okay, medyo uminit na naman ang ulo ko kaninang umaga dahil nadinig ko na naman itong ASF at napag-usapan na naman yung state of calamity. Pero kaming mga tinamaan ng ASF, may pangako pero walang pera. Ano
Yeah.
po ba ang reaksyon ninyong mga magnenegosyo sa pagbababoy regarding the declaration of state of calamity daw?
Yeah, after 1 and 7 months, no, na tinamaan tayo ng ASF, ngayon at least dahil sa mga senator, no? Si Senator Kiko Pangilinan, Senator Cito Beltran, and yung mga senator ang nag-push nito para maayos ito na maging state of calamities. Medyo late, no? Pero maski paano, sana yung pagbayad sa mga racer mapabilis na ngayon. Kasi totoo lang, umabot ng 7 months to 1 year ang pagbayad, no? Yung iba hindi pa nabayaran. So talagang kawawa yung mga racer.
Ginagalit mo naman ako eh. Ako, pinangakuan pa ako on air.
Yeah.
Pinangakuan pa ako on air on this program. Pinangako sa akin, Sitaw, basta ma-file mo yung claim within 2 weeks. Nandiyan na yung pera. 2 weeks ka mo. 4 months na. Anyway.
Baka 2 years yun na Manong Cito, nagkamali lang yung
Nako.
number of yung months, years siguro yun.
Mabuti na lang hindi ko sila kumpare dahil kung hindi talaga ibabalik ko yung kandila pero kulay itim na. Ngayon matanong ko lang Kasendong, no? Kasi you were mentioning that the senators were behind this declaration of the state of calamity. Now, gaano katagal inabot? Kailan ba sinulat nila Senator Pangilinan, Senator Cynthia Villar itong proposal to the President to declare a state of calamity?
Matagal na rini-request, no, ng Senado yan since March.
March of this year or last year?
Last year. Pero etong year lang ito na na talagang pinus, no, dahil gustong mag-angkat ng marami ang Secretary of Agriculture from other countries, pero hindi nilang tinutulungan ang atin na tinamaan ng ASF.
Okay.
And nagbaba ng taripa, no? Sinabi ka ni Secretary Ramon Lopez kanina na yung protection ng ating hog industry, yung tariff na binigay ng WTO na 30% tsaka 40%, dapat protection yun. ang nag-request pa na ibaba yung taripa is ang ating Secretary ng Agriculture na nag-request na tariff commission.
Okay, matanong ko lang Kasendong. Kasi last 2 minutes o last 1 minute na lang tayo, boss. Makakatulong ba itong declaration na ito in what way? Quickly.
Yeah. Bali yung parating natin ngayon from other country, dapat i-test yun. Kung may ASF, dapat gawin ng DA na yan, no? And of course, yung sa local government, quick action na ibig sabihin kailangan bayaran kaagad yung mga tinamaan para once and for all kasi may na yan na naka-state of calamities yan, yung pera kailangan na ibigay kaagad. Yun ang we hope na yun ang gawin.
Okay, so basically there will be indemnification kung meron pa, and then mapoproteksyonan yung mga magbababoy, matetest yung mga imported na baboy, but that's it.
Yeah. And yung kumpiyansa na kasi kung na-test yung imported na baboy, kasi yun ang nag-spread dito sa ating bansa Para at least mag-alaga ulit. Kasi yun ang hinintay natin. Kung matest yung imported na karne, na sigurado lahat na pumasok matest, may kumpiyansa tayo na pwede
Di-
mag-alaga ulit.
Do you have any idea how much money we are talking about o ilang victim farmers ang naapektuhan na hindi pa nakakatanggap ng bayad nila, yung mga backyard hog raisers dito sa indemnification fund na ito?
Kasi in-isolate nila sa 20 heads eh. Kung
Oh.
kasama yung mga nagre-claim ngayon na 30 heads, marami yun, no? Yung mga 40 heads, umaabot yan ng 1.5 million siguro, no? Na dapat kasama. Pero hindi nila sinama eh. Pero yung maiiwan, yung ngayon, with the new outbreak, automatic yan, dapat kasama lahat.
Okay. Well, thank you, Kasendong, and I promise you, babalikan kita in another episode pag mahaba-haba lang kasi kinakasapa namin itong issue na ito ng ASF and the state of calamity. Thank you very much, Caro Sendoso.
Yeah. Maraming salamat po. Cito?
Okay. That's Caro Sendoso and siya po yung ating laging pinupuntahan, pampalamig ng ulo ko. But the point is, we were promised indemnification fund, 5,000 per head. Basta patayin lang namin lahat ng baboy na may ASF. Yun, sabi ni Kasendong, milyon, 1.5 yung mga baboy ba yun? Wala pa rin. Secretary William Dar, wala pa rin. Thank you very much for watching us this day, May 12, 2021. Have a good day. God bless all of you. I'm Cito Beltran, and that's today's agenda.